So now that we have learned about superior, inferior, then anterior, posterior, and medial lateral, now we will learn some other terms, okay? So palmar surface, the anterior surface of the hand is called the palmar surface. And plantar surface is the inferior surface of the foot. Proximal and distal. That means anything proximal means anything that is closer. Okay, when we are comparing 2 points on the limbs, so we will say proximal and distal. The one that is closer, then that is proximal, and the one that will be further away, that will be distal. Okay. And then some more terms. Next slide we will learn. Now superficial and deep. Superficial means like closer to the skin, like more like outside. Superficial means outside, and deep means when you go inside, and inside more deeper structures. That is the deeper structures. Okay. So when you're studying, for example, the stomach, and you're cutting up the stomach, so the skin, that will be superficial. But when the inside things, like inside the organs, they will be deeper organs. Like they are not like superficial. The skin is superficial, and then like inside the organs are deeper. So anything like this will correlate. You will know when anything is like more closer to the skin, or they're like above, and they will be superficial, and deeper structures are deep. Internal and external means like anything that is inside, that is internal, and external means anything that is outside. Okay. It might be in relation to a hollow organ or a cavity or a structure, anything like, so internal, external. Now ipsilateral and contralateral. Ipsilateral means same side. Contralateral means contra, means opposite. Okay. So here we have inserted some pictures so that you can understand. So superficial, here see the superficial thing. Anything that is deeper, that is deep. See, like, let me show it to you. So this thing, this center, this is very deep, like compared to this, right? So this will be superficial, this will be deep. Again, when you will compare this line and this line is deeper considered to this. So this is superficial, right? This is deep. Okay. And internal means like this inside structure of the, like, for example, this is a cup and this has some kinds of tea or coffee inside it. So this drink, this is inside the internal portion, and the cup is external. Okay. Next slide, please. No, not deep is internal. Internal, external is some other terminology, and like deep and superficial is other. Let me erase these. So someone wanted to know ipsilateral and contralateral. So ipsilateral means on the same side, and contralateral means opposite side. Okay. Okay, so I was explaining ipsilateral, contralateral. Ipsilateral means on the same side of the body. Okay. And contralateral means opposite. When two structures, they're opposite to one another, that will be contralateral. Not always contralateral is diagonally opposite. No, it's not necessary. But like when two structures, they are in opposite relation to each other, then that condition we will call contralateral. And when two structures, they're on the same side of the body, like they're on the same side, then this thing will be called ipsilateral. Okay. And bilateral, you can see this is bilateral in this figure. Yes, I will explain 1 second. And the next slide. So bilateral means both sides of the body. Now invagination and evagination. Invagination means inward, and evagination when something is coming out of a cavity, that is evagination. Supine and prone positions. Supine means when body is lying flat on the back, that is supine, and prone means when the body is lying face downwards. See, this is supine position. Body is lying flat with the back below, and that is supine position. And when the body is lying flat, but the back is above, and like the abdomen, the frontal portion, the anterior portion of the body is below, that is prone position. You can see here. Okay, so now some terms are used in osteology. What is osteology? The study of bones is called osteology. Osteo means bones. Logy means study. Okay, study of bones is called osteology. So some terms are used in osteology, like for example, line, ridge, or crest. It is a linear elevation. Whenever there is a linear elevation, it is called a crest or a ridge, okay, or a line, okay. And then tubercle or tuberosity, like when there is some rounded elevation, that rounded elevation is small, then that is called tubercle. When it is a little bit bigger, then that is called tuberosity, okay. Tuberosity or protuberance, okay, protuberance. So some some terms are like that used. After that, spine or styloid process. When there is a sharp elevation, okay, sharp elevation, then that thing is called spine or styloid process. Styloid process is present in some specific bones, like in fibula, there is a styloid process. Then in like radius, there is a styloid process. So it's a sharp elevation. And then a rounded area, that is called a head. Condyles are when it is like oval shaped. Trochlea when it is pulley-like. Okay, so you will learn these terms mainly when you are like studying bones, but like now just a rough idea. It's like a rounded articular area, then that will be called head when it is a perfect sphere, and condyles when it is like oval shape. Okay, next slide. Now, pit or phobia, it is a depression. Depression, like when it is going inside. Pit or phobia is a small depression. Fossa is a large depression. Groove or sulcus is like an elongated depression. Okay. Notch is like, it is when binded by ligament or something. Like this is not possible to understand like this. Let me show you in respect to a bone. Okay. Anatomy is everything about practical study. Now let me show all these things in respect to a bone. So let's take this rib again. Okay, this rib again. Can you all see me? Is video and audio clear? I have turned on my video. Okay. So now elevation. So this is the bone. Here there is a small elevation. Can you see this clearly? There is a small elevation. Okay, small elevation. This will be a kind of, you can say it as an elevation, a prominence. This is a prominent area. It's a prominence. Okay. Now this thing also, you can see this. Is it clear? I don't know. This is like a tubercle because it is a small rounded elevation. So it is a tubercle edge. Here also you can see small rounded elevation. See, can you see this small rounded elevation? All these things are normal, but here it is a small rounded elevation. So this is a tubercle, but it is very small. So it is called tubercle only. And then when we will see the femur, see, this is the femur. This is the femur bone. And here, this is also a rounded elevation, but it is so big. So this will be called a tuberosity. It's bigger size, not so small. But this one is smaller. This one is a small rounded elevation. So this is called a tubercle, but this will be called a tuberosity. Okay. Now, line or ridge or crest. So here you can see there is a sharp line. Sharp line. Can you see? Like a sharp line like thing. This is a ridge or a crest here. Sharp line. I don't know if the camera is picking it up. I'm trying hard. Sorry, please, this is the first class I'm trying to explain things via video, so I don't know if it's being clearly captured. So it's a sharp line. This will be called a ridge or a crest. Okay, let me explain. So see, this is the femur. Okay, this is the anterior end of the femur. This is smooth, but here there is a sharp, like an elevation, sharp elevation. Can you see? Sharp elevation. See, sharp like elevation. So this is a crest or a ridge. This will be called a crest or ridge. So this is like in relation to bones. You will learn these things. These are some terminologies that are used in the bones. And sometimes these tubercles or tuberosities, they have other names also in the bones, like malleolus, In tibia, there is the malleolus, and then like trochanter, some names like that. And then spine. Spine is a sharp elevation. So this is the scapula bone. This is the spine, sharp elevation. Can you see? It's not like a ridge or a crest. This is like an elevation. It's coming out of the bone. It's like a process. Okay, it's like when something is like bulging out in bone, then this is called a process. Then this is sharp thing. It is called a spine. Okay, spine. After that, head. Let me show you. When there is a rounded articular area and like completely rounded articular area, then this is spherical. This is called the head. So this one, what will be it called? Head of the femur, right? Head of the femur. This one's completely rounded articular area and spherical shape, completely spherical shape. So this is head of the bone. Yes, the femur, this one forms the ball and socket type of joint, and this femur along with the hip bone, they form the hip joint. Now condyles. So let's say humerus. This one is the humerus. Okay, so this one is spherical, round. This one will be the head of the humerus. Humerus is the bone that is placed here. Okay, head of the humerus. This is completely round. Okay, this will be the head of the humerus. But these things that are present here in the lower end or the inferior end, then these things are like a little bit ovoid shape. These are called the these are ovoid shape. Can you see? So these are condyles. And then trochlea. Trochlea is present in another bone. It's not present in this humerus, but it's like another type of elevation, but not head or not like condyle. When it is pulley like, then it is called like trochlea. Okay. Now depressions. Let me show it to you in the femur. So pit or a phobia. It is a small depression. So this head of the femur. This is the head of the femur, but there is a small depression here. Can you see a small depression here? Like it's going inward. A small area is going inward. This small depression, it will be called pit or phobia. So this one is called like the pit present in the head of the femur. Here, ligament is attached. Okay, ligamentum femur, like the head of the femur ligament is attached here. So this thing, it will be called pit or phobia. And then groove or sulcus. How will you say groove or sulcus? So now in this rib, here you can see, let me show you. Here there is a groove. There is an area. Can you see? Like this is the elevation. I told you this is a line or a ridge or a crest. Okay. And this is the inferior, sharp inferior border of the rib. And here there is a groove. Like there is a depressed area in between these two, depressed area. Here there is a groove. In this groove, some vein, artery, nerve are present. Okay. So this is a groove or a sulcus. We can call this a groove or a sulcus. Can you see? This is groove or sulcus. Okay, now notch or incisura. Okay, notch or incisura when it is binded by ligament. Now again, coming to the femur. Let me show you the right femur. This one, this is markings I have done on my bone. So this one, you can say this is a notch. This one is a notch, like a depressed area. Depressed area, can you see? This one is the head of the femur. This is a tuberosity. There is a like depressed area over here. There is this you can call a notch. Okay. Now canal or meatus. Canal or meatus is when a notch like it is formed like this. It is a length. It has a length. Okay. This will be a canal or a meatus. So our ear, it has a canal. So you can see there is like a length like this. This will be a canal or a meatus. So this thing, meatus, you can say. Okay, after that, ostia or orifice. Since I am on video, I cannot see the lectures and see my copy. Okay, never mind. So like orifice or ostia. So when like this thing will be an orifice. The canal is like open from the both end. Okay. This thing will be an ostium or an orifice. But canal, it like ends like this, like a length. Okay.
Show them
now
in the scapula, like scapula has that when you put your finger over there, then we can make it like a orifice or so. Should I use
Here now in scapula, I am going to show you. There is this depression area here. Can you see a small depression?
a
This
red
is a
marked
notch.
area? A red marked area.
Red mark. This is a notch. But when some ligament passes over here, it will become a foramen because it's a gap. It will become a foramen.
Just like that.
Here a ligament will pass and it will be. Okay. So this is notch, and then foramen also. In bones also you can see foramen, like very minute foramen, nutrient foramen is present in the femur. Okay, and humerus also. Let me search it and show it to you. I don't think you can see it in the camera, but this is the nutrient foramen. Can you see in the bone there is a minute opening? This one, can you see? This is the nutrient foramen. This is called a foramen. Yes, foramens is like opening. It is opening, it's called foramen. Okay, there are so many foramen present through, like in all kinds of bones. In the skull bone, in the skull, you can see so many foramens are present through which nerves passes, artery passes, so many structure passes. But like in long bones, when a foramen is present, this type of small foramen present, this is called nutrient foramen, because through this foramen an artery passes, which is called the nutrient artery, and that artery provides nutrition to the bones. So it is called nutrient artery, and the foramen that contains that artery is called nutrient foramen. Okay, I hope you understood. So moving on, next slide. Now there are some terms related to the movements of joints, like flexion, extension, lateral flexion, some things like that. Flexion means like bending, bending. Okay, you can say bending means flexion. See in this picture, and extension means extending. So you see, this is my hand. Now this is extended. Okay, extended. This one, when I will do like this is flexion, flexion, extension. Okay, flexion, extension. When this is my hand, this is extended. This is extended. When I will do this, flexion. I have flexed my hand, extended my hand. Okay, can you say, you cannot see in the video my whole hand, but like you can get the idea, right? This is flexion, this is extension, flexion, extension. Okay, and then also thumb. How will you flex the thumb? Flexion of the thumb, extension of the thumb, flexion, extension. So did you understand? And now adduction, abduction also, let me show you. Adduction means closer to the body, adding, adduction. Okay, adduction, like say my hand is like this, so this is abducted away from the body, abduction. And when I add this to my body, adduction, adduction, abduction, adduction, abduction. So I hope you understood. And circumduction, when you move it like a 360 degree, circumduction. This is circumduction, 360 degree movement. Circumduction, when your shoulder joint also you will move like this in 360 degree, that is circumduction. Okay, so I hope you got an idea of adduction, abduction, flexion, extension, circumduction. Okay, now moving on to the next slide. See in this figure also, adduction, abduction, fingers like this, adduction. When the fingers are close together, that is their adduction. And when they're far away, then that is abduction. Opposition is when you move your thumb in a 360 degree, opposition. Next slide. See, adduction, abduction of the thumb I showed you. Now rotation, you can see whenever a part is rotated, that along a long axis, it is rotation. Medial rotation, when it is rotated towards the midline. Medial rotation, when it is rotated away from the midline. Lateral rotation. Now this figure will be clear to you when I showed like my movements. See, that is medial rotation, when you're moving it towards the midline. medial rotation. When you're moving it away from the midline, lateral rotation. Next slide. So now you can see inversion, eversion, and like pronation, some supination. So pronation, supination you learned earlier. Like pronation means when you are lying down with face below, that is prone position. So in relation to the joints also, there is some things like pronation, supination. Pronation means medial rotation of forearm so that the palm of the hand faces posteriorly. Okay, that is pronation. It will be difficult to understand like this. Inversion, eversion means like, see, in this figure, you can see pronation, supination figure. Yes, inversion here, when you're like a sole of the feet, you are bringing like towards the midline, that is like inversion. Okay, and eversion means away from the midline. And then pronation, supination. Supination means palm is like above, like in the superior there is the palm, that is supination. And when pronation means palm is below, dorsum is above, that is pronation. Okay, next slide. Retraction when mandible, we will show the figure. Next slide. Next slide. See here, retraction, protraction. When mandible is the jawbone. Jawbone, when you move it forward, then when you move the jawbone forward, then that is called protraction. And when you like take it backward, that is retraction. In this figure you can see. And then elevation means above, depression means below. See, next slide. Now cutting the bodies into different types of sections, then we can get planes. We will show figure. Next slide. So we posted a picture like this in our group. You can see that this is the sagittal plane. Okay, when the body is divided into two halves along a midline, that is sagittal plane. And when like the sagittal plane is not just exactly in the midline, but otherwise, then that is parasagittal plane. Okay, let me show it to you. So the planes, I will explain it to you. Can you see the video? Okay. So when we will cut the body, say for example, we are cutting the body like this, okay, midline, two halves. Our body will be divided into two equal halves. So this is the sagittal plane. We have cut the body in sagittal plane, okay? But it is not, when it is not exactly midline, say for example, this is exactly midline, okay, sagittal plane. But when it is not exactly midline, for example, if we are cutting the body here, okay, here, then that will be called parasagittal plane, okay? Parasagittal plane, mid-sagittal plane, okay? And then coronal plane, when we will cut the body like this, okay? This one was sagittal, this is coronal plane. Coronal plane will divide the body into anterior part and posterior part. When we will cut the body like this, that is in the coronal plane, we will get an anterior portion and the posterior portion. And when we will divide the body in like sagittal plane, we will get like this two halves, and like this one portion will be the medial end and this will be lateral, okay? This part will be lateral, this part will be medial. And transverse, like cutting the body from your abdomen, transverse. For example, when you cut like the body transversely, this is transversely, then you will get superior, inferior, okay? So these is the planes, these are the anatomical planes. Now let's show the slide. So now I hope this figure is clear to you. So median plane or sagittal plane. Median is when you will divide the body into exactly right and left halves. And sagittal plane is any vertical plane parallel with the median plane. So it can be exactly on the median plane, exactly along the median plane. When it is, then it is mid-sagittal plane. But when it is like any other vertical plane, then parasagittal plane. Okay, parasagittal plane. I showed you. And then coronal or frontal plane, it will divide the body into anterior and posterior parts. Horizontal or transverse plane, it will divide the body into superior and inferior parts, or upper or lower parts. Okay, next slide. Now, some terms related to clinical anatomy are symptoms, sign, diagnosis, prognosis, therapy. Symptoms are the complaints of the patients. Say, for example, I'm a patient, okay, and I will go to the doctor and I will say, okay, I'm having pain in my stomach from 2 days and I cannot eat properly. Some vomiting is occurring also. So the complaints of the patients are symptoms. All these things that he has said, all the complaints that he has given to the doctor, those will become called symptoms. Okay, so what were the symptoms of the patient? The symptoms of the patient were that she cannot eat properly. Okay, she's having pain in the stomach. Okay, she's having vomiting. So these are the symptoms of the patient. And when the doctor will find some things, those are called the signs. So say, for example, when I have given these symptoms to the doctor and the doctor has checked me up, okay, and he has found, for example, some kinds of like food poisoning. Okay, so this is a sign, and he himself found, not always whatever the patient says is like the exact finding, because patients don't understand, right? So the doctor found that, okay, this patient is having pain on the stomach, on this region, she's having pain. So that finding is called signs. Whatever the doctors will find on the patient, that will be called signs. And whatever the complaints of the patients are, the patient's language, that is the symptoms, and the doctor's findings, that is the signs. And after all these signs and symptoms, the doctor will determine, give some test and identify a disease. Okay, after some test and some reports, okay, like the doctor will find that, okay, he or she is having some food poisoning. So that is the diagnosis. He has diagnosed the disease. Now, prognosis means the probable outcome of the disease. Like this prognosis means like, okay, this food poisoning can lead to some severe condition also. Okay, maybe he or she may have typhoid or some other condition maybe. So that is the prognosis of the disease, probable outcome. And also, okay, the food poisoning is now solved, we have given medicines, there is no more problem, it is fine now. So this is good prognosis. Okay, that means good outcome of the disease. That is called good prognosis. But when this food poisoning has like even further advanced and some more problems are occurring, bad prognosis. That means bad outcome of the disease. So this is prognosis, good prognosis, bad prognosis. You will see, like when you go to read in anatomy, also physiology, biochemistry, you will see many words like, okay, the patient, good prognosis, good, bad prognosis. Then you will understand that the outcome of the disease is good, that he or she has started recovering, it is good prognosis. But he or she is again like not recovering and the condition is declining and declining, that is bad prognosis. And therapy is any medical treatment. So for the food poisoning, the doctor gave me some medicines, that is the therapy. Okay, any kinds of medical treatment is therapy. Next slide. Someone asked a question. Signs are vitals. No, signs are the findings of the doctor. Vitals, okay, blood pressure, pulse, okay, respiration, breathing, everything. These are also signs, but the like pain in abdomen. Okay, the doctor will find that the patient complained, and then that is the symptom. But doctor is also finding, okay, he or she is having pain on the stomach. Okay, pain in the stomach. Okay, so that is also a sign. Okay. And then inflammation. What is inflammation? Any kinds of local reaction due to tissue injuries called inflammation. You don't need to know this in details now in first year, second year. You will learn this in fourth year. But whenever you will see that at the end of a word there is itis, you will have to understand that inflammation. Now just understand that inflammation is like body's reaction to any kinds of infection. Body's reaction to any infection is called inflammation. And like, say for example, there is infection going on in the appendix, and body's reaction to that is called inflammation. So in that infection of the appendix will be called appendicitis. So whenever you will see itis, you will understand, okay, inflammation of the appendix is happening here. So appendicitis. Tonsillitis, itis. So inflammation of the tonsil is happening here. Okay, so many other money. So whenever you will see itis, that means inflammation. Okay. Like say for example, cholecystitis. Cholecystitis, like it is the inflammation of the gallbladder. Anything chole means relating to the gallbladder. So cholecystitis means inflammation.
Just a second, Sadia. If the class ends, please rejoin. A little bit things are left, little bit. Okay, so please rejoin.
Swelling and inflammation are not always the same, but whenever inflammation takes place, swelling will occur. But sometimes swelling can be also non-inflammatory. But usually whenever inflammation takes place, that area will get some swelling. Okay, because swelling is a sign of inflammation. So whatever organ is inflamed, it will be swelled. Okay, so just now you need to know that itis, whenever there is itis attached to a word, it means inflammation of that. Okay. Pancreatitis. Pancreatitis means inflammation of the pancreas. Okay, just now you need to know this. And ectomy. Ectomy means removal of part of a body. Appendectomy. What do you mean by appendectomy? When we are removing the appendix, it means ectomy. Tonsillectomy, when we are removing the tonsils because of some problems, then that is tonsillectomy. Otomy means to open and then again close the organ for some clinical procedures. Laparotomy. Cystotomy. Okay. And then ostomy means if we open an organ and leave it open, like tracheostomy. We have done tracheostomy. If the person is having some breathing problems, we will do tracheostomy. We will open the organ and leave it open. That is tracheostomy. Next slide. Okay, so that's it. Our class is over.